Так, здравствуйте. Hello, everybody. I don't know. Okay. Okay, hello. Um, uh, Dear colleagues, dear doctors, hello, everybody. We are about to start our lecture. I am Dr. Livshyts, Chair of Obstetrics, Gynecology and Perinatology #1. I hope you're hearing me well, and I'm asking all of you who are here with me today to register, to put names. I see some familiar names like Aditya. I see some people who I know here. Okay, please put your name and your group, and we'll start in a moment. My lecture will be devoted to the family planning issues. It's quite important for any doctors to know these specific problems and this field of medicine. Okay. I have nothing to disclose. I have no conflict of interest before to start this lecture. And I hope the information will be interesting to you as a future doctors and as a humans. Okay, family planning. Family planning allows people to attain their desired number of children, babies, and to determine the spacing between pregnancies. And this is achieved by using of different contraceptive methods and as well in some cases a treatment of infertility, coping with infertility. So two things: contraception, and on the other side is investigating a treatment of infertility. Family planning, especially if we speak about contraception, goes many ages, centuries ago, because people always wanted to be able to control their fertility, to know more about fertility, ability to have children or not to have children. Even if you see on the slide, during ancient Egypt times before Christ, scientists found papyrus, Kahun papyrus, which is dated 1850 before Christ, and some earliest document descriptions of birth control. Interesting, at that time they use honey, leaves, lint, and women placed this interesting stuff inside the vagina to block sperm. They believed in it. In Jewish communities, women in Jewish communities, ancient communities, they used citric acid and soak sponges, and also inserted these soaked sponges inside vagina as a method of the birth control, of the family planning. Dong Quai, also known as Chinese Angelica, has long been known for its powerful effect of to control menstrual cycle, to control fertility. In ancient Greece, silphium was also used as a birth control method. Um, what are the benefits of family planning or contraception? Uh, it's obvious that promotion of family planning uh, and using of contraceptive methods for women and couples are essential for securing their well-being and also the autonomy of women while supporting the health, general health, reproductive health also, and development of communities. People may control the number of population with using of different birth control methods. Um, uh, Woman's ability to choose if or when to become pregnant has a direct impact of her health. And family planning allows spacing of pregnancies and space between pregnancies and can delay pregnancies in young women who are in increased risk of health problems and sometimes even death from early childbearing. We know that girls who deliver child when they are younger than 16 years old are in greater risk of different health issues, health, and even sometimes may cause death delivering child for such young ladies. So it prevents unintended pregnancies most of all using of birth control methods. We need to prevent unintended pregnancies, uh, and not only in youngsters, also in older women who are also in increased risk for their health because pregnancy in women with advanced reproductive age are in increased risk of their health and even sometimes life. Pregnancy for them are maybe very dangerous. So family planning, birth control methods are enabled to control this situation also. So this actually the benefits of family planning. And of course, for particular family methods of birth control enables women who wish to limit the size of the pregnancy of the family to do so. Evidence suggests that women who have more than 4 children are in increased risk of maternal mortality. By reducing rates of unintended pregnancies, family planning also reduced the need of unsafe abortion. Unsafe abortion is a very big problem. Criminal abortions, especially, very big problem for healthcare systems in every country, from poor resource country to high resource countries. And so we using birth control methods, we also try to prevent abortions at all itself, and especially unsafe abortion. And we in the situation where COVID-19 is spreading across the world globally, and literally a couple of days ago, WHO published online the article where they are worried about problems of unwanted pregnancies during this time and access to abortion for women during this time, because in some countries during this coronavirus infection pandemic, many women cannot access to consultations for family planning, and if they are pregnant and want to terminate pregnancy, they may go to unsafe abortion. That's the problem. Even now, during this time, we are sitting here in our rooms, hostels, and so on. Well, let's go further. Family planning also help us to reduce infant mortality because we can prevent unwanted pregnancies. Sometimes women cannot, they don't terminate pregnancy and deliver child. And we know that infants of mothers who die as a result of giving birth also have a great risk of death and poor health. So family planning helps us here. A very important issue is HIV infection, and family planning reduce the risk of not only unintended pregnancy, but also pregnancies among women who live with HIV infection and resulting in fewer infected babies and even orphans. Uh, uh, and we need to remember that male condoms and female condoms, barrier contraception, we'll talk about later on, provide dual protection against unintended pregnancy and also protection against sexual transmitted diseases, including immunodeficit virus. Uh, Very important thing I touched a little bit. Pregnant adolescents are more likely to have preterm or low birth weight babies, and if we speak about contraception, family planning issues with adolescents, we can prevent pregnancies in such patients, and babies born to adolescents have high rates of neonatal mortality, uh, and these many young girls who become pregnant, they need to stop to go to school, and so very unfortunate situation, and this has long term implications for them as individuals, and for their families, and for communities as well. Uh, and family planning enables people to make informed choices about sexual and reproductive health, also because people start to understand better their organism, their health, and they they become healthier, if I could say so. Awareness of their sexuality and reproductiveness and reproductive health are greater in such patients who such persons who come to obstetrician gynecologists for consultations. But actually, who provides consultations for family planning topics or for contraceptives use? Family planning usually in this country, in Russian Federation, in Ukraine, usually we provide doctors, obstetrician gynecologists provide services for family planning. But if you look globally, maybe in your countries, in your fair countries, it's easily accessible through midwives and other trained health workers who specially trained to anyone who person who are interested in family planning to control fertility, including for adolescents, for teenagers who may be sexually active and they need, as I mentioned before, to be protected for unwanted pregnancy and sexually transmitted diseases. So midwives, nurses who are trained, they provide available and culturally acceptable contraceptive methods. They can. Other trained health workers, for example, community health workers, also may provide counseling in some countries, like in Canada, for example, in the States, and some family planning methods may be recommended and prescribed by such not doctors. For example, pills, contraceptive pills, and condoms can be recommended by specially trained health workers. For specific methods like sterilization or IUD insertion, this kind of patients or individuals need to be referred for doctors, obstetrician, gynecologists, and urologists also, if we speak about men. Family planning service studies some important topics like demographics, population dynamics, medical topics, medical issues like abortions, prevention abortions, deliveries, rate of contraceptive use, and some reproductive diseases like infertility, sexual transmitted diseases, and others, and prevention of such diseases. So family planning touches quite important things which related to any national healthcare system, especially demographics. You know that in many countries, in Europe, for example, in Russia particularly, demographics is very important things. And President of Russia, he provided a special program for demographic now in Russia. What other modern method contraceptives need to be how we what we should think about modern contraceptive methods? What are they should be? They should be very effective. They should be easy to use for specific person, absent a low rate of adverse effect for any method. Usually, patients don't want adverse effects. It should be safe for health, and sometimes maybe some of methods maybe even some may have advantages for health, and we will touch a little bit later. It should be affordable. Of course, it's very important. The economics in medicine now plays a role, and somebody need to pay for services. In some countries, the system pay, medical system, healthcare systems. In some countries, patients pay. So and should be reversible if we speak about young patients, young clients, young persons, and should be irreversible if needed, especially in the if we speak about women of her advanced reproductive age. So this is important thing to remember. Effectiveness, easy to use, absent a low rate of adverse effects, safe for health and good for health, affordable and reversible or irreversible depending on the desire of the specific patient. If we speak about efficacy, effectiveness of contraception, we need to know, and you need to know the name of Robert Pearl, and the name is Pearl's index, the specific denominator which says us the effectiveness or non-effectiveness of method of contraception. The lower the Pearl index is the higher efficacy of contraceptive method, and vice versa. So Pearl index, this is the number of pregnancies number of in women within a month multiplied by 1,200. And some scientists, they criticize this Pearl index as not very accurate, but globally nowadays still Pearl index is considered one of the most important indicator of the effectiveness of use of specific method of contraception. So the lower Pearl index is the better efficacy. The higher Pearl index, more pregnancies for 100 women within a year. So the worse, the less effective the method of contraception. I hope you understand what I said. That's not difficult. So, what are the methods we use for when we counsel the patient about contraception? First, you need to remember that we divide them in several groups. First is very popular and very well-known hormonal methods of contraception. Next is the intrauterine methods of contraception, surgical methods of contraception, uh, barrier methods of contraception plus spermicides. Natural methods of contraception, we don't need to forget them. And postpartum contraception is related to this because lactational amenorrhea, LAM, LAM, is related to natural methods of contraception in postpartum period, breastfeeding as a method of contraception. And we subdivide a special group of methods is emergency contraception. So this is all methods on the screen on this slide. Let's touch hormonal contraception. Now we divide hormonal contraception on different methods of using these hormones. As you remember, hormones are very active substances which our body produce, and they are very effective even in small parts, in a small amount, in small dose. These substances have systemic effect on the whole body of the whole organism. So the hormones and people starting from the 20th century, middle of the 20th century, started to use exogenous hormones as a contraceptive method. So how to give these hormones? Orally, transvaginally we can recommend, transdermally we can prescribe, injectables, implants, and specific intrauterine system which has hormones inside, also in pharmacological market available now. So orally, vaginally, transdermally, injectable, implants, and intrauterine hormonal system. If we speak about history of hormonal contraception, and it's said that in the previous century, in the 20th century, it started to use actually 60 years ago, hormonal contraception started as a method for population control fertility. But investigation of hormonal contraception, using of hormones as a contraceptives, started even in the 19th century when physicians and scientists noted that during pregnancy, folliculogenesis, the active work of follicles stopped because of probably hormone secretion of this corpus luteum. In the 30s of the previous century, it was noted that high doses of hormones induce contraceptive effect on women, and commercial production of progesterone, one of the women's steroid hormones, hormone of their second phase, luteal phase hormone, started to produce actually from plant Diascaria mexicana. The chemist Russell Marker was the pioneer, one of the pioneers who started commercial production of progesterone. Well, in the 50s, oral synthetic progestins started to produced by Carl Jersey and Frank Colton. Also very important that Catherine McCormick, the philanthropist, donated all her finances to the Harvard Medical School for development of the strategy for development new hormonal contraceptive, modern hormonal contraceptive pills. This money she gave to physiologist Gregory Pincus and biologist Min Chang and gynecologist John Rock, and they were the pioneers who started to produce on the factory pills, more contraceptive pills. And actually, like in many fields of what people investigate, accidentally was found that add of estrogen to progesterone, actually mestranol to norepinephrine, inhibit pituitary function and blocks ovulation. So it was found accidentally in a experimental work, and it was noted, and scientists since then started to use and pharmacists started to use combination of estrogens and progesterone as for combinative oral contraception particularly. So combined hormonal contraception contains two steroid hormones, estrogens. We know that estrogen is a different group of hormones like estradiol, estrone, estriol, and we call them estrogens. And also the second partner is a progesterone and its analog. We call them progestogens or progestins. So combined oral contraceptives, they contain two sex steroid hormones. What are the methods of action of hormonal contraception shown on the slide? The main event, is prevention of the release of oocyte of the egg from ovaries. So preventing of ovulation by inhibiting gonadotrophin secretion, FSH and LH as well, less but also so inhibiting of follicle stimulating hormone gonadotrophin, which is produced in a pituitary gland. And the secondary method of action is the thickening of cervical mucus, blockage of passing sperm inside the uterine cavity, meeting with the egg, with the oocyte, and of course changing of receptivity of endometrium, because steroid hormones pair of these steroid hormones change receptivity and thickness of endometrium as well. Progesterone or progestins, they act together with estrogen. We call this synergic action. So less hormones, less estrogen is needed for prevention of ovulation, the blockage of ovulation. This is very important thing because people want to give less drug, less dosage of the hormone to have main effect and less adverse effect, as I mentioned before, for any method of contraception, actually for any drug in medicine. The main effect should be controlled and less adverse effect and complications. So combined hormonal contraception contains mostly atenyl estradiol, which is synthetic estradiol as estrogen, but progestins or progestogens may be very different, and they subdivide in several generations, from first to the fourth. But estradiol usually comes as in 99% of pills comes as atenyl estradiol nowadays. If we look to the history of hormonal contraception, you see in 1961, actually almost 60 years ago, the first contraceptive pill in Europe was Anovlar. Uh, you cannot find it anymore because of it's removed from the pharmaceutical market because of the dosage of estrogen inside. Well, but Anovlar was one of the first pill in the world, and the first pill in Europe. And starting from that time, from the 60s, evolution of hormonal contraceptives, of hormonal contraception to decrease the level of estrogen, because estrogen, although they have specific effect to block ovulation, they may have some adverse effect. And you see on the slide, the dosage of estrogen was decreased dramatically from 60s till now, from 115 micrograms of ethinyl estradiol to 20 micrograms to modern combined hormonal contraceptive pills, for example. Um, Estrogen doses were lowered after reports of increased risk of ischemic stroke, myocardial infarction, and pulmonary embolism with high dose estrogen preparation, and that was documented in papers because risk of thromboembolism is related to high dosage of estrogen, and this adverse effect leads to the problem with the general health, and scientists started to reduce dosage of estrogen. But the lower dosage of estrogen in a pill, for example, the less main effect to controlling of ovulation. So that was the reason to add some progestin to control this biochemically, to control ovulation, releasing of eggs. If we speak about progestins, I've said that we subdivide them in 4 groups, 4 generations. You see here, probably okay, progestins. The first generation, progestins are norethindrone, ethinyl diacetate, norgestrel, and norethindrone acetate. Nowadays, usually in Russia, in Europe, you will see only pills which contain norgestrel, usually norgestrel as a progestin. But levonorgestrel combined contraceptives you can find across the world. This is the second generation progestin. We believe that the more advanced generation of the progestins, the better for less adverse effects. So the third generation of progestins is norgestimate and desogestrel, which is very popular compound of combined contraceptives, and drospirenone is the fourth generation progestin. And you see, we want to have progestational effect for progestin. Obviously, progestins, we need progestational effect, not estrogenic effect, not androgenic effect. We want them used only as a progestins, as a progesterone. And you see that many of even the first generation pills, they work very actively as a progestational agents, but unfortunately they have some estrogenic effect, and even more they have androgenic effect, which for young lady who who is very who needs appearance, and we know that androgens may provoke some acne vulgaris, for example, and some other problems, metabolic problems. So we don't like progestins with some adverse effects. And if we look at third and fourth generation pills with drospirenone and desogestrel, for example, we see that the very high effectiveness as a progestins for desogestrel, for example, and not very effectively, not as estrogens, and very and moderate androgenic effect. And we speak about drospirenone. It doesn't have any estrogenic effect and any androgenic effect, and have mild progestational activity. And also, this is because this is a metabolite of mineral corticoid. So this is very important to remember. And if we speak about classification, biochemical classification of progestins, we need to remember that some of them go from pregnanes, and some they are considered to be estranes and gonanes. And only this last drospirenone, they go from spironolactone branch. You see here. So this drospirenone related to spironolactone, which obviously has mineral corticoid effect. And the first, second, and third generation progestins, they go to the, for example, medroxyprogesterone state, they pregnanes, and these which derive of testosterone, 19 testosterone, estrans gonanes, they like desogestrel, gastodan, levonorgestrel. That's why they have some activity, androgenic activity. And this linestrenol and norethindrone, they have some estrogenic activity as well, because they come from estranes. So this is the fourth generation drospirenone. Is considered one of the best progestins nowadays, without androgenic activity, without estrogenic activity. But the problem, the progestogenic activity is not very profound, very light, but it's still okay. Let's go further. So combined oral contraceptives, they are very effective. So if we give pills which contain both hormones, estrogens, and progestins with specially designed formula, the effectiveness of these birth control pills are very, very high. So the Pearl index very low, in other words. So effectiveness is up to 99% if a specific person, woman, patient, takes this pill as prescribed. Of course, studies found that efficacy may drop a little bit in a real life situation, approximately 4 or 5% less than perfect use, which accounts for patient non-compliance and inappropriate use. For example, patient forget to take the pill in a row. So that's why typical use is usually lower than desired, recommended use for oral contraceptives, because in a real day situation, patients may throw up the pill and forget to take it, and so on. Some patients may have very aggressive metabolism, probably because of this. Oral formulations of contraception differ with regard of the dose as well as combination, and usually because of progestins. Estrogen, as I mentioned before, usually is ethinyl estradiol. Currently, oral combination contraceptive products contain low level of estrogens, usually between 20 to 50 micrograms, usually 30 micrograms of ethinyl estradiol, 20 micrograms of 30 micrograms of ethinyl estradiol, um, and also progestins. Um, uh, Combined oral contraceptives can be subdivided to monophasic and biphasic or triphasic also. So that means that monophasic preparations says that every pill in a package contains the same dosage of hormones, and biphasic or triphasic pills may so different pills may be different in compound. Uh, uh, so that's why we call them multiphasic combined oral contraceptives. For example, let's look at the slide. Usually, oral contraceptives, which we prescribe patients for birth control or sometimes for treating some problems, they contain 21 pills in a package. Usually, a patient needs to take one pill a day for 21 days, and then to have 7 days interval break. Usually, the start, and it's shown with the yellow arrow. Usually, start of the package is on the day 1 or 7 of the menstrual cycle of the lady. Only one birth control pill. The brand name is Clyra. It doesn't have other competitors' names. Clyra is a novel combined oral contraceptives. We call it COCs. It is multiphasic and it doesn't contain ethinyl estradiol. As I mentioned before, 99%, almost all pills available on the pharmaceutical market contains ethinyl estradiol as a estrogen. But Clyra is different. It contains estradiol valerate, which is very close to natural estradiol, the more active estrogen. And also it is multiphasic. You see here on the slide, it contains 28 pills in the package, and different pills with different color contain different level of hormones. Usually, and you see on the slide, starting from the beginning, estrogens higher, and at the end of the pill, estrogens becomes lower, and vice versa. Progestins you'll see no progestins at the start, and then they go higher at the end of the pill of the package. Sorry. So this is Clyra, which is, I'm repeating, is different to other contraceptive pills because it contains estradiol valerate, not ethinyl estradiol as other pills. So, safe for oral route, we can prescribe combined hormones, estrogens and progestins, transdermally and vaginally. Transdermal patch, the brand name is Evra or Ivra, Ortho Ivra, deliver hormones through the skin, and also it contains estrogen and progestin, and it's now available across the world, so, from Asia to the United States as well. So the patch mechanism of action is similar to oral contraceptive pills, and actually you see here on the slide uh, Evra contains 20 micrograms of ethinyl estradiol, and the third generation um, progestin, norelgestromin, 150 micrograms. And action mode of action is the same: the blockage of ovulation via transdermal diffusion of this hormone into the blood. The patch can be applied to the upper arm, upper torso, abdomen, buttock. On the it's okay. It stays for 1 week. A new patch should be applied in a week. So this should be detached. The first one should be detached and applied the second one. The second should be detached and the third one. So the same 21 day is controlled by transdermal system. So this is again combined transdermal contraceptive. Vaginal approach, vaginal contraceptive ring. The brand name is NuvaRing or NovaRing. Contains again ethinyl estradiol and etonogestrel, which related to the third degree, progestin, desogestrel, and works as well like oral combined oral contraceptive together, these two, progestin and estrogen. And you see, because this vaginal special vaginal ring, contraceptive ring, the ethinyl estradiol here is decreased to 15 micrograms, even lower than the lowest oral contraceptives. So this is very effective method of contraception, hormonal contraception, very high typical use. So not many mistakes women do when using vaginal contraceptive ring. And very effective in the desired action. So 99% effective, very low Pearl index in this vaginal contraceptive ring, NovaRing. It looks like here. It comes in a specific box, and it's flexible. You see here in the slide, and can be inserted by any woman into her body. It's flexible and usually no ring, and as well as every patch, they started like COCs, starting from the first days of the cycle. And save for every patch, which is detached every week, vaginal contraceptive ring NovaRing is inserted just for 21 days. Once you inserted it, and once lady inserted into her body, she needs to remove it, to take it out in 3 weeks. So it may stay during night, day, within 21 days. It's shown on the slide like it's located, so it's very flexible. It take place very easily if you insert it, like tampon. Patients insert tampon, hygienic tampons. So, and it stays here inside. And the method of action is very the same, like in COCs and like in IVRA page, the same. Estrogens absorbed and progestins are absorbed by through the vaginal epithelium and block ovulation, block releasing of eggs, and this is the one of the most important method of action of any hormonal contraceptive. Plus, again, thickening of the mucus, changes of receptivity, and thickness of endometrium as well. What are the most side effects of any combined oral contraception and vaginal contraception and transdermal contraception? If we speak about specifically NovaRing, irritation inside the vaginas, they may take place. This specific common side effect, adverse effect. But for any combined hormonal contraceptions, headache may take place, including migraine aggravation, Mood changes can be seen. Uh, Nausea, vomiting, weight gain, and sometimes weight loss. And if breast pain, breast discomfort or tenderness, very rare painful periods, abdominal pain, very rare. Very rare is acne formation on the face, and changes in sexual desire. If we speak about Novaring's adverse effects, irritation inside of vagina I mentioned before, and vaginal discharge may take place in such patients. But nonetheless, combined hormonal contraception may have some benefits, some advantages for women. Uh, uh, all contraceptives has shown to decrease risk of ectopic pregnancy because they provide defense for any pregnancy. Dysmenorrhea, painful menstruation, anemia because of profuse menstrual bleeding, some protection for endometrial cancer formation, ovarian cancer prevention if patient takes more than 1 year in a row birth control pills. Ovarian cyst formation, benign cyst formation can be prevented by using combined hormonal contraception. Cases of colorectal cancer is decreased because of using these pills. Benign breast disease is lower in a chance to find benign breast disease like fibroadenoma formation. Pelvic inflammatory disease, osteopenia, and osteoporosis is seen rare in patients who take oral contraceptives. Also, birth control pills may also improve cycle control. They may elevate acne symptoms and hirsutism symptoms, especially pills which contains cyperterone acetate as a progestin. Anyway, some contraindication is seen on the screen here, absolute and relative. You see, we don't prescribe hormonal contraception for patients with hypersensitivity to exogenous hormones. And if patient is pregnant, it's no reason to prescribe contraception. Smokers more than 35 years old is the contraindications, heavy smokers. Patients who have cerebral vascular coronary artery disease, patients with thromboembolic accidents in anamnesis, suspected or known breast cancer. If patients have some undiagnosed vaginal bleeding, what can be a symptom of the cancer of the cervix or cancer of the endometrium, and liver impairment. Liver function impairment is also an absolute contraindication. And relative contraindications are hypertension disorders, migraine, diabetes mellitus, epilepsy, jaundice in pregnancy before, gallbladder disease because of possible acceleration. If planned surgery to be needed to be operated on the patient in the future couple of weeks, you need to stop using contraceptives. And sickle cell disease, because in such patients, it was noted the effectiveness of hormonal contraception is decreased. I think we need to do a 5-minute break. 5-minute break, sorry. 5-minute break. And we will come back in 5 minutes, okay? I hope you'll see in 5 minutes here. Okay, my dear friends, I think we can continue the second part of the lecture. Uh, I hope you are here and can hear me well. Mm, okay, so please write if you're here or who is here again, who came back, and I'll continue. So anyway, I'll continue. Uh, uh, I'll continue talking about hormonal contraception. We touched combined hormonal contraception, and now we'll speak about progestin only contraception, which is usually come in everyday practice as a progestin only pills. We call it mini pills. Provide an oral alternative for lactating women, as progestins, unlike combination products, have been shown to decrease milk production. Mini pills are very good option for women with contraindications or intolerance to estrogen-containing contraceptives. It's good for women who would like to become pregnant in the near future because as progestin-only pills do not always stop ovulation. Mechanism action of progestin pills or progestin-only pills are thickening of cervical mucus to block sperm intrusion into the cavity, uterine cavity, and so it prevents egg or oocyte from meeting with sperm. Also, one of the important methods of mechanism action of progestin only pills is the changing of receptivity of endometrium, and sometimes, not in all women, prevention of ovulation. So less effect for ovulation prevention. Mini pills or POPs need to be taken 1 pill a day, every day without interval for rest. When we spoke about COCs, you remember I told you that 21 day in a row the pills should be taken, and then 7-day intervals should be taken. This is not the same for POPs. These pills should be taken on everyday basis and without interval. It must be taken strictly at the same time every day. Typically effectiveness for such method of contraception is 90%. Ideal effectiveness is 97% effectiveness. So Pearl index in this method of contraception is lower than COC or combined oral contraception. Anyway, it's related to high effective contraceptives, as well as intramuscular progestin injections, which contains in this country and probably in globally in many countries medroxyprogesterone acetate 150 milligrams. Brand name is Depo-Provera. It was the first non-oral hormonal contraceptive in the United States and across the world. This is metabolite of progesterone, medroxyprogesterone acetate, is injected into deltoid or gluteal muscle every 3 months. So this is a very popular contraception method for women who don't want to take pills on everyday basis. Method of action, the main method of action is suppressing ovulation and changes or altering the cervical mucus. The first injection of the Depo-Provera should be given on the first 5 days 5 days of menstruation, 5 days of period. This is very popular in African countries, in United States as well, and in some European countries, methods of contraception. It doesn't contain estrogens, so like mini pills, it contains only progestins. Um, in the United States, FDA approved special form like subcutaneous Provera, Depot subcu, which contains even less hormone, 104 milligrams of medroxyprogesterone acetate. It can be given to patients herself, so it's not needed to go for nurse help and for doctor's office. So patients may inject to her. It's not available in this country so far. Common side effects of the Poprovira are irregular bleeding, intermenstrual bleeding, sometimes weight gain, delays in the return of ovulation, possible reduction of bone mineral density, especially in smokers, for whom we prescribe this method of contraception because it doesn't contain estrogen, no thromboembolism risk. But anyway, on the other hand, bone mineral density, if it's taken for more than a couple of years, is could be seen. Ovulation usually recurs in half or even 1 year after product discontinuation. And duration of use does not seem to be related to the length of time of recurrence of ovulation. Implants. Now in Russia, we have access to implants as a method of progestin implants. Actually, I am talking about progestin implants. You see, the small sticks contains only progestins, which is very effective. It should be inserted by a specially trained doctors, usually doctors, not nurses or midwives. It's a minor surgical procedure. You see here a special needle, quite thick needle, usually is inserted under the skin in this kind of fashion. It's very effective. It has typical and ideal effectiveness, probably the same, because it's inserted, it stays for several years, from 3 to 5 years. It should be inserted surgically and removed surgically. Although it's a minor surgical procedure. So implants are now available in many countries, as well as in Russian Federation, and probably in your countries is also available. It's very popular for patients who want to refrain from fertility for several years, and it considered a reversible method of contraception because you take it away, this stick, this implant, and your fertility comes back. Again, side effects of progestin implants is usually the same as the Poprovera and progestin pills. For example, abnormal vaginal bleeding sometimes is seen in around 20% of women who may have no bleeding at all, so amenorrhea during implant using. And sometimes a patient may come to your office and says, doctor, I have headache, I have bloating of my breast. Mood changes also can be seen as a common side effect in implant users. So don't forget about it. So let's stop talking about hormone contraception and we will continue with other methods. Intrauterine devices. These are small contraceptive devices that are inserted into the uterus for pregnancy prevention. It has very long history. Ages, centuries ago, people noted that if they insert something into the womb of the woman and even animal in veterinary, it can prevent unwanted pregnancy. So nowadays, to the two types available of IUDs, intrauterine device is stays for IUDs, copper containing IUD, and also we have hormonal containing IUD. Both types are very effective methods of contraception. It's long term, reversible contraception as well, and usually different mode of IUD may stay for different years inside the body, usually from 5 till 10 years can be used. Mechanism of action of intrauterine device, actually, although it's used for many decades in clinical practice, it's not well known and still debatable. But many science show us, many investigations showed us that copper-containing IUD usually decreased sperm ability to reach the uterine cavity and fallopian tubes, and so no fertilization occurs, as well as creating cellular changes to sperm that cause it to be non-viable. Ovulation has been shown to be prevented in some cycles, but it's not the method of action in copper containing IUDs, only for progesterone releasing IUDs. But this system primarily functions secondary to progestin activity in the cervix and endometrium. Look at the picture here, and you see IUD in place in utero here. And this is the actual size of IUD. The size of this stick and arms of IUD is very small, usually 3 to 2 centimeters in dimensions. This is copper containing IUD to the right on the screen. You see the spiral, copper spiral across the stick and the arms. And here is the hormonal IUD. This is the reservoir which contains levonorgestrel, which absorbs, goes to the body of the woman. So it stays in the uterus. And again, one of the mechanism of action is to preventing sperm goes inside of the uterine cavity and fallopian tubes, and changes on the uterine lining as well, endometrium, mechanically. If you do speculum examination, insert the speculum inside the vagina, you'll see the cervix. Here is the cervix, and you see the two threads usually go inside the cervical canal, and it touch the vertical stick. You see here the vertical stick, and these two threads are needed for several reasons. Usually, it's very easy to see IUDs in place or not. Not necessary to do ultrasound. Next, it's very easy for the woman herself to inspect, to put some fingers inside the vagina, and she may feel two threads, one or two threads. That says for woman that she still has inside the IUD. And also, it's these threads are necessary to easy taking out the IUD if it's needed to. We need to stop using this method of contraception. No other reason of using these two threads. On this slide, you see modern types of IUD. You see here specific brand names, different shapes. Usually they come in a T shape or Medusa shape, and specially designed package for to insert, especially to insert in the uterus. Surgical methods of contraception. Female contraception, we call it tubal ligation. This is the permanent contraception, so it's considered not reversible method of contraception, to block or to cut fallopian tubes. So it doesn't touch hormonal hormonal physiology of the woman. So only block of the tubes and not meeting between oocytes and sperms. The same method, surgical method, is a male sterilization. It's called vasectomy. It's a permanent contraception which blocks or cuts vas deferens, which carries sperms from the testicles outside. So it keeps sperms out of ejaculated semen. So still, it is some ejaculate, but no sperms inside this ejaculate. Surgical method should be considered as permanent, non-reversible. I think it's clear. In this diagram, in this picture, you'll see tied and cut fallopian tubes from the both side. You see here, and should be this procedure is usually done done by via laparoscopy. You see the picture of the female pelvis, uterus, ligamentum ovarian propria, left ovary, right ovary, and both tubes are here, right and left. And on this screen, you'll see here the tubes are tied with special ring. Some ring is put on the tubes, on the isthmic part of the tube, on the right tube, and on the left tube. This is the left tube picture. This is the right one. So this is a very popular method of permanent birth control, family planning, for patients who do not want to give birth anymore. It should be considered irreversible, so permanent. As well as vasectomy or vasoresection, sometimes called. Only 7% of families use this method globally. It's not popular in Russia. As far as I know, it's popular in China and India, but maybe I'm not correct. But it's written on the literature. It's one of the most popular methods in China and India. So usually patients go to the doctor's office, and urologist, usually urologist or family planning specialist, does small cutting of the testicle skin and then cuts vas deferens. Some methods of anesthesia can be applied: general sedation, mild sedation, or applied specially anesthetic, and it's done usually on outpatient basis. If patient wants to get pregnant after vasectomy or after the tubal ligation, this nowadays usually these patients should address to infertility treatment for infertility clinic, and they do IVF procedure. So in vitro fertilization, usually only the method of restoring fertility for such patients. Several decades ago, doctors applied reconstructive tubal surgery and vas deferens reversal, but clinical studies showed that these methods of restoring fertility have very, very low potential. So nowadays it's better to recommend after vasectomy or after tubal ligation, recommend in vitro fertilization treatment if a patient changed her mind or his mind. And let's touch a little bit other methods of contraception, like barrier methods of contraception, which is very popular across the world. And you see that debut of barrier methods of contraception started in the in the 15th century, when syphilis was the epidemic disease. Now we have pandemic of COVID infection, coronavirus disease, and that time the syphilis was epidemic, and people wanted to be prevented from this disease, and scientists of that time, like Gabriel Falloppio, wrote the opus, the scientific opus, the Morbo Gallico, which means in English about French disease, because they thought that time they thought syphilis was originated from France, which is not correct actually. And British committee noticed the decrease of deliveries because of condom use. So even that time, British Scientific Medical Committee noted that using of condoms may prevent also from unwanted pregnancies. It was very important notice. Um, so during the centuries, physicians and society considered condom use as a moral. Until early 19, only high society people used condoms because of very high price and absence of information within a low social groups of people. And what is more important, in the 1944, Mr. Goodyear invented the process of vulcanization of rubber, and this started wide production of male condoms made of rubber. Sexual revolution in the middle of the 20th century, and later HIV and AIDS spread allowed to widen usage of condoms, which are latex nowadays, latex condoms. First condoms was made from natural sources, like the wall of the bowel uh, of animals like lambs. Uh, and now you'll see many different commercial brand names of male condoms. They are very effective if they used correctly, and unfortunately, they are not very effective if they're not used correctly. Sometimes they get slipped off, so 85% is commonly used. But it's very good that is safe for unwanted pregnancy prevention. It also may protect against sexually transmitted diseases, including HIV, hepatitis B and C as well, um, herpes simplex as well. It's not very popular in our country, and probably you will never see it here. But maybe in your countries you may find female condoms. Uh, it is inserted by a woman herself into her body right before the sexual intercourse. These female condoms are more pricey. They cost more than male condoms. Probably this is one of restriction of their use across the world. Female condoms is quite effective. 90% effectiveness of is noted for such method of contraception. So pearl index is higher than for hormonal contraception, of course. And you see here that typical use is 79% of effectiveness of female condoms. And as well, it's also because it's barrier method of contraception, or it protects against sexually transmitted diseases. That's the good story. You'll not see any more intracervical stamps, which can be inserted by the doctor before into the cervical canal. No, I never seen and never used such methods of contraception nowadays. Cervical caps, even 10 years ago, you could buy in the drugstore, and doctors usually insert this method of contraception, this cervical cap, to the woman's body, and especially trained women patients may insert to themselves into the vagina. So this method also works as a barrier method to prevent sperms go inside the cervical canal in the uterine cavity and then to fallopian tubes and block so not to prevent meeting between eggs and sperms. Diaphragm is principally the same like cervical cap. Uh, last several years I didn't see it in the drugstore anymore, so it's not very popular nowadays in our country at least. So if we compare different methods of contraception, their failure rate, or other words effectiveness of different methods of contraception, spermicides like non-oxylol-9 on chloride benzalkonium, spermicides, especially suppository, which can be inserted inside the vagina, and combined oral contraceptives, progestin-only pills, diaphragms, condoms, Depo-Provera, IUDs, copper containing IUDs, Norplant, and tubal ligation, you'll see that the failure rate is highest in the diaphragm users. It is quite higher in spermicide users, and quite high in condom users. And what are the methods more effective? Of course, tubal ligation, implant inserters, Depo-Provera, IUD, progestin-only pills, combined oral contraceptives. It's quite old investigation made by Dr. Trussell, but it's still the same data. WHO says it as the same. The most effective methods are combined oral contraceptives, Depo-Provera, tubal ligation, and IUD. Other methods is less effective. Let's speak about natural methods of contraception. First of all, you need to remember that Mother Nature gave us possibility to prevent unwanted pregnancy after the delivery of the baby. So lactational amenorrhea, breastfeeding, and amenorrhea, which is called LAM protocol, prevents releasing eggs, oocytes from the ovaries. Again, prevention of ovulation, and provides temporary contraception for new mothers. Requires exclusively full breastfeeding, day or night. Very high effective, and this is the natural method, which very good for both for health for mother and for baby. It's good for the mother breast, and it's good for immune system for the babies. So don't forget about this method of contraception if you counsel the patient after the delivery. When you discharge patient home, please talk a little bit about lactational amenorrhea method, which is very good for within 6 months after the delivery. After this time, patients may ask for other method contraception. That's another story. Also, natural methods of contraception is BBT, basal body temperature method, prevents pregnancy by avoiding unprotected intercourse during fertile days. Usually, patients monitor their temperature, rectal temperature, every morning before getting out of the bed. If patients noted that basal body temperature became higher for 3 days, that means that ovulation occurred and she is not fertile during this menstrual cycle, and sex can resume on the 4th day after the elevation of the basal body. It's quite effective with the correct and good use, but still 75% of patients, well, sorry, 25% of patients may have unwanted pregnancies. So this method is good for patients who may be pregnant and give birth after this maybe not unintended pregnancy, but it's not very good method for patients who are likely to abort unwanted pregnancy or unintended pregnancy. We don't need to forget this. Also, we call two-day method of contraception. Patient monitor her cervical mucus type. This is prevents pregnancy by avoiding unprotected intercourse during the most fertile days. When it's sometimes difficult to use if a woman have a vaginal infection or another condition that change cervical mucus. But unprotected coitus intercourse may be resumed after 2 consecutive uh, so-called dry days where no abundant mucus is noted by a woman. Days without secretion, 2 days without secretion, and patient may have intercourse, uh, unprotected intercourse. Symptothermal method prevents pregnancy by avoiding unprotected vaginal sex during most fertile days. Women track her fertile pregnancy periods by observing changes in the cervical mucus and as well basal body temperature. So this combination of checking mucus, checking basal body temperature, and also some patients may notice that the cervix is softened a little bit in the middle of the menstrual cycle. That may help to say this is the most fertile day or not. May not should be used with caution after the abortion, because many mistakes after this occur around menarche and menopause, and in conditions where body temperature is increased, so it doesn't work well in such situation. Calendar rhythm, calendar or rhythmic method. It's very easy to describe. Women should monitor their menstrual cycle, and to count days of menstrual cycle is, for example, and then subtract. If patient has regular 28 or 30 days menstrual cycle, patients should subtract 18 from the shortest cycle length. For example, if the shortest cycle is 28, so you need to subtract 18. So the first fertile day may be the day 10, starting from the first menstrual day. And from the longest cycle, for example, 30-day cycle for the same lady, so you need to subtract 11. So 30 subtract 11 is 19. So starting from day then 10 to 19, it's advisable to not to have intercourse. And again, this method have a very high Pearl index up in the typical use, up to 20%, 25% of where patients may have unwanted pregnancy or unintended pregnancies. And this method should be used in caution when using drugs like anxiolytics, antidepressants, some antibiotics, which may change the ovulation in such patients. Emergency contraception. Actually, it's not the method of contraception, it's the approach for contraception for patients, for people who didn't use planned contraception. I would say that planned contraception is better than emergency contraception. But in real life, sometimes patient may come to your office and ask, please, doctor, give me advice what to do if, for example, condom was broken and they don't want to have pregnancy and they don't want to abort the future pregnancy. So what to do? So 4 methods are available now. The first is the high doses of progestins. So it is only progestin pills. You prescribe levonorgestrel, for example, 1.5 milligram once, and it works usually quite well. Emergency contraception also can be using COCs, combined oral contraceptives. Usually 3-4 pills of low dose COCs. You need to give it twice. And IUD insertion can be utilized for such emergency contraception, because usually doctors and midwives, they recommend insert IUDs for planned contraception in the first days of the cycle, but in case of emergency contraception, they can insert IUD in any day, even in the mid cycle. And quite new drug for emergency contraception is a ulipristal acetate. The brand name is Dwella in this country. Ulipristal acetate 30 milligrams. This is antiprogestin, so this is biochemically substance which blocks progestin receptors, and it also can be used as an emergency contraception. Um, Also, you need to remember that there are several groups, several categories we keep in mind when we prescribe or recommend or counsel patients for contraception. The first category, first group, is the condition where is no restriction for use any contraceptive methods. Usually, these patients, these people are healthy people. They just come for they don't have diseases, extragenital diseases, so they come for contraceptive advice, and you prescribe any methods of contraception they want, they need it. The second group, the second category, the patients usually here may have some problems with their health, general health, or may have some conditions which can be can be some theoretically contraindications for, but still using of methods of contraception usually overweight the theoretical or proven risks. The third group, so the first two group usually yes, you can prescribe. The second group usually yes, with some exclusions, and the group 3 and 4 usually no, not to prescribe contraception. So we speak about safety of contraception now for people. The third category, condition where the theoretical or proven risk usually overweight the advantages of using the method. For example, patients wants to take birth control pills, and she's 36-year-old, and she's not heavy smoker. She's not heavy smoker, sometimes smoked. So this is the condition theoretically better not to prescribe. Better not to prescribe COCs for such patient. And category 4 that represents unacceptable health risk for contraceptive use. For example, patient has endometrial cancer, and you should never prescribe IUD insertion for such patient. Or for example, patient is heavy smoker, she is 40 years old, she is category 4. You never should prescribe because it's unsafe method of contraception for such patients. I think you understand this. This is this is medical eligibility criteria. Conditions that expose a woman to increased health risk as a result of unintended pregnancy. It's very important that sometimes unintended or unwanted pregnancy may exaggerate condition which patients may have. For example, if patient has breast cancer and she becomes pregnant, the breast cancer will go more aggressively after it, even if you terminate the pregnancy. So breast cancer is the problem. Patients should be recommended them a specific method of contraception. Patients with heart disease, especially valvular heart disease, long-term diabetes, more than 20 years old, duration of diabetes mellitus, insulin dependent with angiopathy is the problem, is the condition where the unwanted pregnancy may cause some health and even life risks. I talked about cancer, epilepsy, hypertension, severe hypertension, HIV, usually can be HIV patients may have some problems with their health if they had unwanted pregnancy. Ischemic heart disease, patients with malignant gestational trophoblastic disease, choriocarcinoma, malignant liver tumors, hepatoma, hepatocellular carcinoma of the liver, schistosomosis of liver, cirrhosis of the liver, stroke in anamnesis, systemic lupus erythematosus, thrombogenic mutations, active tuberculosis. These patients should be counseled for contraception because for them unintended pregnancy may pose very high risk for their life, even not for their health, for their life. It's another story. Sometimes it's very difficult to find the appropriate method of contraception for such patients because in many patients, for example, with breast cancer, you shouldn't prescribe combined oral contraception. You must not prescribe combined oral contraceptives because and estrogens may provoke further progression of the breast cancer. So for such patients, for example, IUD, non-hormonal IUD, is the method of choice, for example, in such patients. For patients with stroke in anamnesis, it's better to use non-hormonal methods of contraception, maybe IUD insertion again. Um, um, Contraceptives, family planning, actually, it's very important thing, and that's why International Classification of Disease number 10 have a lot of different coding of such visits to your office or your future office, your clinics. So you need to remember you can find information how to proper coding for statistic and financial reasons probably in the future. So it's important to know to remember. And one of the last slides in my presentation, my lection, you can find it in this WHO document, the third edition, Selected Practice of Contraceptive Use. You see the typical use and the perfect use, so ideal use of different methods of contraception, and the typical use may be different. Like I told you, for example, combined oral contraceptives, ideal use have Pearl index 0.3, and in typical use in the real life, patients make mistakes, and Pearl index may be as high as 9% of women may have unwanted pregnancies. So that's very important to remember to know. So only several methods like surgical methods, permanent methods like tubal ligations and vasectomy have the same, almost the same perfect and typical use. And in combined oral contraceptives, you see big difference. IUD is almost the same, typical use and ideal use, perfect use. This you need to remember. And for patients who don't want pregnancy, and if they the chance or the likelihood for them to do abortion, we need to prescribe very active, very effective method of contraception, because we don't want to make abortions. We want to preserve reproductive health of our population, of our people, and abortion still is considered as a procedure which is not very good for not only for physical health, for psychological health of a woman and for the family, as well as the physiological is not very good and may be dangerous. So please remember it. Prescribe effective contraception for women who need effective contraception. And of course, if consider about some